Hey, my name is Drew. I'm going to be your nurse today. I'm going to wash my hands. Can you tell me your name and date of birth?
Janet Price, 9/26/67.
Okay, Miss Price. Today we're going to be checking your vital signs. So I'm about to get started. I've checked her temperature. It was 98.7. The normal is 98.6 to 99.1. Higher temperature than that can indicate infection or hyperthermia, and a lower temperature than that can be hypothermia. All right. So now I'm just going to check your blood pressure real quick. So, you relax your arm. First, I'm going to palpate the brachial artery to see to what number I need to pump it up to. Okay. So, it stopped at 110. I'm just going to pump it up to about 130, and I'm going to listen. But in real life, I would wait a full minute before I listen for the check. The first sound was heard at 108, the last sound was heard at 60, so your blood pressure was 108/60. The normal range is 110/60 to 139/79. So your systolic was a little low, but that's okay. So now I would assess the patient's apical pulse. I would get at the midclavicular line, go down 5 intercostal spaces, and I would auscultate right there, about 5 down midclavicular line for 60 seconds. Let's say I did that, that would be between 60 and 100, or if it was less than that or higher than 100, it would be abnormal. So now I'm going to palpate your radial, let's do this one, your radial pulse. Okay, I've got it. And I'll do that for 60 seconds. Okay, so the normal, it would be a regular rhythm, anywhere from 60 to 100 beats a minute. And usually I would palpate that for 30 seconds and not tell the patient that I'm checking her respirations for the other 30. I would get the heart rate multiplied by 2 and then get the respiratory rate multiplied by 2. The respiratory rate should be between 12 and 20. A low respiratory rate can lead to a bunch of different health problems. It can cause acidosis, and a higher respiratory rate can lead to respiratory alkalosis. So, done your temperature, check your blood pressure, check your respirations. I have checked your apical pulse. Now we're just going to talk a little bit about oxygen saturation. If I had an O2 sat monitor, I would stick it to the patient's finger, preferably with no nail polish on the nail. And that should be somewhere between 95 and 100. If it's low, it means the level of oxygen in their blood that is attached to the hemoglobin is abnormal. That can, that just means you're not getting enough oxygen in your blood. So ideally that should be between 95 and 100. So I've done your O2 sat.